There are 13 eligibility categories under the IDEA, the Individuals with Disabilities Education Act, and it's important for parents to remember that an eligibility category is different than a diagnosis. Just because a child has a diagnosed disability does not necessarily mean that that child meets the eligibility criteria under the federal statute. So these are the definitions under the educational model as to whether or not a child is a special education child, a child with a disability, as defined by law.
Here's the definition of other health impairment. Other health impairment means having limited strength, vitality, or alertness, including a heightened alertness to environmental stimuli that results in limited alertness with respect to the educational environment. That is due to chronic or acute health problems such as asthma, attention deficit disorder, or attention deficit hyperactivity disorder, diabetes, epilepsy, a heart condition, hemophilia, lead poisoning, leukemia, nephritis, rheumatic fever, sickle cell anemia, and Tourette syndrome, and adversely affects a child's educational performance. Other health impairment requires a bit more explanation.
Yeah, it does. And that's because the definition is very lengthy, and most of us just refer to it as OHI, and that term gets thrown around a lot. Other health impairment is what I like to refer to as sort of the catch-all provision of the IDEA. It's the eligibility category that when an IEP team, an individualized education program team, is trying to consider whether or not a child is eligible, very often, if the child doesn't neatly fit into another eligibility category, this is the one that comes to mind. Now, the definition is quite clear, even though it's lengthy, it is clear. It's just one of those categories that is used a lot because sometimes a child just doesn't neatly fit into another definition, and so we use this one. And so I just caution parents that when you hear this term and then you read the definition, you may be a little concerned thinking, my child doesn't have any of these diagnoses, or maybe I should be more worried about this definition because of the way it reads. And I would just say it's come to be used very often as a term or as an eligibility category when we know the kid needs help, but we're not quite sure where else to put the child.